Hi, I'm Ben Gideon. I'm a lawyer and founding partner of the law firm Gideon Asen. We're a firm that specializes in handling medical malpractice cases on behalf of patients and their families. And I wanted to talk to you for a few minutes today about how we go about presenting complicated medical cases to juries. One of the challenges in these cases is that juries often don't have any medical expertise themselves. Doctors and most of the time nurses are not sitting on juries involved in medical malpractice cases, which means that we have to explain the medical issues in the case in a way that ordinary people without a medical background can understand. So, I want to discuss today how we go about doing that. And one of the things that we do is we like to create visuals that will illustrate what we're talking about from the medicine in the case in a way that juries can see it for themselves. In order to do that, we will create photographs or images, or as you're going to see today, video animations to help illustrate the medical issues in the case. The animations you're going to see today were created by our partners and friends at High Impact, which is a firm that we use often to help us create medical illustrations for our cases. We've had really great success in working with them on many cases over the years. The case I want to talk to you about today is a case that I tried a few years ago. It involves a 67-year-old man who was feeling sick at home. He was often tired in the afternoons and just had an overall feeling of not being well. He went into his local hospital and they took blood tests when he went there. Those blood tests showed that he had bacteria in his bloodstream. But unfortunately, the test results never got reported to the man's family doctor. And so for the next 8 months, the man continued to go back for medical treatment, but nobody acted on the test results. As a result, he ended up having bacteria get into his heart, get into one of his heart valves, eat it away and destroy it. And then he went into heart failure, which is when they first realized the problem. And from there, he ended up going for the rest of his life without having a heart that really worked the way it should have. So I want to take you through now how we would illustrate the concepts involved in this case to the jury. What we like to do in these cases is start with how things are functioning normally, how the body is supposed to work before the malpractice occurs. So we're going to first illustrate to the jury what the heart's role is in taking deoxygenated blood from the body and pumping that out to all the organs and tissues of the body that need it. This helps the jury to understand something that, of course, we all understand how important having a functioning heart is to our life. So you can see here the blood comes into the heart. It's illustrated as blue because that means it is deoxygenated. It does not have any oxygen in it. And the heart's job is to pump that out to the lungs. Then it comes back from the lungs and now it's red because it's been oxygenated. And then it goes back to the heart, and the heart then pumps the oxygenated blood out through this big blood vessel called the aorta, and it goes out to all of the tissues and organs of the body that need oxygenated blood to survive. Now, we like to illustrate the different parts of the body that are important in a case. Here, we want to talk about the four chambers of the heart so the jury understands where those are. So, the top chambers, the right and left atria, and the bottom chambers are the right and the left ventricles. Again, we don't try to confuse the jury by getting into things that they don't need to know for the case. We try to focus just on the things they need to know in order to understand the evidence and the issues involved in the case. So we're going to show them where the heart valve is that was involved in our case. It's called the mitral valve, separating the left atrium from the left ventricle. You can see it opening and closing there to prevent the backflow. And then once again, now we're showing the blood going out of the heart through the aortic valve, which is the big valve that opens and closes as the blood gets pumped out to the rest of the body. So we talk about how the heart functions when it's working properly, getting the blood from the uh, left atrium, going into the left ventricle, through the mitral valve, out through the aorta to the rest of the body. We like to be a little bit repetitive just so the jury really gets to feel comfortable in understanding all of the parts of the body and the issues involved in the case. We want to explain to them that when the heart's beating, that they measure the amount of blood that's pumped out as an ejection fraction, so you can determine if the heart is functioning efficiently, whether you have a good ejection fraction, how much blood is being ejected or pumped out with each pump. So there's another issue that the jury's going to want to know about in our case that involves the heart rhythm, how it beats, what keeps it beating properly. So they're going to learn that the heart is triggered to beat by electrical signals, as illustrated here by the bright lines. So the signal tells the top chambers of the heart to pump the blood into the bottom chambers. And the bottom chambers then fill up with blood. Then there's a slight delay, and then the bottom chambers will pump the blood out to the rest of the body. So having this normal heart rhythm and sequence is really important to having a properly functioning heart and getting blood to the rest of the body. It's really an amazing organ, doing this 50 to 80 times per minute, or 72,000 to 115,000 times every day, something we all take for granted until it stops working right. So that's the first animated sequence. If you click on the next video, I will illustrate the second sequence in our series, which illustrates what happens when bacteria gets into the bloodstream and it infects the heart valve.